Hey, everybody. Alan Weber here from the mayor's office on a Friday afternoon, a little cloudy out, but maybe we'll get some snow this weekend. In the meantime, remember to wear your mask, remember to wash your hands, remember to practice physical distancing, remember stay within your family bubble to the best of your ability while doing takeout and supporting our local restaurants and retailers. We've got to shop local, keep your money here in town. We continue to bring you information to the best of our ability about not just COVID in general, but the topic that I think is really on everybody's minds right now, vaccinations, getting medicine into people's arms. And our guest today is Dr. Wendy Johnson, the Chief Medical Officer from La Familia. And Dr. Johnson, we are getting a lot of questions about vaccinations, how many we're getting, how much vaccine we're getting, how it's being put into people's arms, how people make appointments, which groups are teed up to get vaccinated, how do I get my turn. Everybody I think that I talk to is very eager to get COVID in the rear view mirror, bend the curve, move from a red county to a yellow county to a green county. I'm going to just ask you to give us kind of an overview, and then maybe we can drill down on some of the sensitive issues about what if I think I got skipped, or how do I get in line. But what are you seeing? What are you hearing? You're on the forefront of this at La Familia. Is the pipeline getting smoothed out? Will vaccination, the pace, the rate, the predictability pick up? Over to you, Dr. Johnson.
Sure. Well, I said this last time, and we still have a lot more demand than we have supply. You know, it's a big funnel, and making this top end of the funnel bigger, I don't think is going to help us. So there's a lot of talk about, oh, let's just let everybody in, and whoever gets them gets them. And I personally don't think that's a good idea. That's not what our Department of Health is doing, and I think our Department of Health is doing a good job, even though it's an extremely complex thing. And I know there's been a lot of frustration with the app and all of that. So let me just go through who's right now getting down to the small part of the funnel. You know, who are we vaccinating right now? We're still vaccinating over 75. If you haven't, if you're over 75 and you haven't gotten the vaccine yet, please go to the Department of Health website. And I think we're going to put that on the post here. And if you think you've already registered, check and see, make sure your registration is complete, because there were some glitches in the app, especially early on. If you don't really know how to use technology, or this whole thing is too complex for you, or maybe you got a text and you don't know what it means, please get some help from a younger person in your family, if you can, that can help you. A younger person can register for you on your behalf. So if you don't have a smartphone, if you don't have an email, if you don't understand how to do it on the app, get a younger person that has some of those things. And then when they get the notification, they can give it to you, you know, and let you know when your appointment is, and hopefully help you get to the site. So get some help. There's also a phone number on that Department of Health website. So if you're having problems, call, and they will help walk you through the process. Okay, so that's number one thing for everybody, really. But if you're over 75 and you're like, I haven't been called, I think I registered, I don't know what happened, go back to the site, check your registration, make sure all the information is filled out, and get some help if you need some help. If you're under 75, right now, the vaccination group that is being worked on, and these folks are being called, so my patients included have been called by the Department of Health, is folks with certain chronic diseases. And they include heart diseases, hypertension, obesity, lung diseases, diabetes. Those are the big ones that affect a lot of our population. So if you're over 16 for the Pfizer vaccine and over 18 for the Moderna vaccine and have any of those conditions, you are now in line, and the Department of Health is actively calling people in that group. So if you're really anybody who wants the vaccine should go and register at the Department of Health website, answer their questions, and when your group gets called, will be called. But even with those two groups, we still have a lot more demand than we have supply. We have that little small part of the funnel. And in our community in Santa Fe, the folks that are giving vaccine are the Department of Health, so you have to register. Christus. So I know that they're prioritizing folks. The other group that's eligible now is people with cancer or history of cancer. So that's another big group. I know the cancer center at Christus is going through all the people that are actively on treatment and chemotherapy right now to get that group. If you have a provider at Christus, and especially if you're over 75, again, call them up and say, hey, I don't know if I got skipped, I didn't get called, I'd like to get into the schedule to get vaccinated, because Christus is doing about 1,000 vaccines a week. The Department of Health is doing up to 1,000 a day, I think. So they're doing a lot more. And then I think the only Presbyterian hospital is also vaccinating their patients. So if you're a patient of a doc that's affiliated with Presbyterian, call your PCP. Really, no matter what, call your PCP, because Christus is reaching out to some of the community docs too. We are vaccinating our patients both over 75. So if you have a PCP at La Familia and you haven't been called yet, call your PCP, get an appointment with your PCP to discuss the vaccine if you're not sure if you want it or not, or if you have a condition where you think, yeah.
What does PCP stand for?
Oh, good point. Your primary care provider. Your primary care provider.
I thought
so call your doctor, your practitioner, your PA, whoever is your primary care provider.
I didn't think you were talking about Paseo de Peralta, but you could have been. So get in touch with your doc. Get in touch with your doc and find out where you are. But be polite and be patient. We talked to Lillian Montoya on Wednesday. Some folks are getting a little worked up. They call Christus and they're angry at the person who answers the phone. So, don't shoot the piano player. They're doing the best they can. Be patient. Right. Be a little thoughtful. Remember, we're all in this together. It's going to get better. The supply chain will get worked out, and the number of vaccinations will go up. But until then, if you have a question, ask for an answer, but be a little patient about
it. Yeah. One change that's just happened is, I know it's been frustrating. Some people got called and were turned away, I've heard, or the Department of Health app, they registered and they went back in and then they weren't really registered. So like I said, there were some glitches early on. Now the Department of Health app is working so that you're not going to get, there was also problems that was in the paper with event codes being sent out to a bunch of people and people getting shots before their turn. The Department of Health has fixed a lot of those glitches, and they've made it so you can't get an appointment unless you're in the group. So just recently they fixed that, so that we shouldn't have that jumping in line problem anymore.
Yeah, it's worth remembering. I mean, we just started getting vaccine a couple of weeks ago. I mean, it's relatively recent. We've been waiting for vaccines for a while. Now they're here. It's fair to be eager. It's fair to be a little frustrated and wonder why there isn't better information. What's the best source of information, Dr. Johnson? Where can people go to find out things like you were just describing? Where we are in the priority list and how many vaccinations are getting put into people's arms on a regular weekly basis, say? Is there a website for data?
Well, I think it's that same Department of Health website is probably the best one for New Mexico data. Within that, there's a dashboard. I mean, if you wanted to Google probably Department of Health's vaccine dashboard, it would come right up. And that gives you the data about how many vaccines. And New Mexico is, well, I think we slipped from number 3 place to number 4 place last time I looked at it yesterday. We're behind Connecticut, Alaska, and West Virginia. And then New Mexico, we're tops in the country for a bunch of things, for the percent of our population that's been vaccinated, and for the percent of vaccine that we are getting into arms. So we're up close to 80%, 70 to 80% of the vaccine that's come into the state, we've already gotten out into arms. And some states are down around 50%. So, we've really, the Department of Health and the hospitals and some of the community clinics that are getting vaccine have really ramped up to be able to get that out the door right away.
And the city, just so everybody knows, we have said to the Department of Health, tell us what you need. I mean, we will help. You want a building on the south side. You want the South Side Library. You want a fire station. You want the convention center downtown. You want our firefighters or EMTs. I think we're all in this together. The point is to be efficient, run a smooth operation. I have heard a lot of compliments from people once it is their turn, that between the time you sign in and the time you get a shot in your arm is 5 minutes. So a lot of very good, smooth, thoughtful, polite, respectful folks are making the system work, but we don't have enough supply yet. We're still looking for more vaccines, and I think we need more syringes. I think the president has called for the use of the Defense Production Act to ramp up production of all of this material. What do you say to folks when they call and they are wondering whether they got skipped, or why somebody they know that they think shouldn't be ahead of them got a shot, or when will it get better? Do you have any kind of, you're kind of a Dr. Fauci for Santa Fe. What do you say to folks who are either eager or frustrated or all of the above, so that we can all kind of feel better about how this is rolling out?
Well, just as you said, we're really going as fast as we can. The other rate limiting step is just the people to actually give the shots. You know, in a lot of states, remember, the Department of Health is not a hospital, it's not a clinic, didn't have a bunch of nurses and doctors sitting around not doing anything, waiting to give shots. They have geared this up with a bunch of volunteers and other folks that they pulled in, and it's really been a very fast effort. What we're going to see in the next couple of weeks, we're going to see National Guard and FEMA has come in and is supporting us more. We're going to see collaborative clinics. We're already talking with Christus, with the county, with the city, with the Department of Health, of maybe putting on kind of mega collaborative clinics with the local docs and nurses in town, and Christus and the hospitals and the Department of Health, all pooling our resources together. And especially when the weather gets warmer and we can do more drive-through stuff, that also will be a thing that we'll see. And I think you're just going to see it ramp up more and more. So I would just say, be a little bit patient. It was a little bit glitchy in the rollout, but the biggest glitchy part in the rollout was the lack of predictability of the federal supply. And that has just gone away literally in the past week or maybe two. So in the past couple of weeks, we've been able to say, okay, this is our order, we're going to get our order. Before that, we didn't know whether we were going to get our order or not. So it's really only been a couple of weeks that we've been able to kind of plan for how many vaccines are we going to get, how many are we going to be able to give out. That's at the whole state level, including the Department of Health. So, you know, that's a huge change. We're also going to see pharmacies, I think, get more involved, and you're going to be able to probably call a pharmacy and make an appointment. So it's going to happen pretty quick, I think. All of that's going to happen fast.
Great. And how's La Familia doing? How are you doing? You're at the forefront of this. Not at the moment, you're at home having a little downtime, but day in and day out, you
Well,
are, as the chief medical officer, you are on the forefront. How's La Familia doing? How's your team holding up? You're under a lot, everybody in the healthcare system has stepped up for us. We should tell them all thank you.
Well, thank you very much for that. Yeah, I'm so proud of my team. They're doing such a great job. We have really geared up. We're going to start, we're giving shots right now at our Alto clinic. We're going to start expanding that to Southside. We're working on plans to address the homeless situation, and especially those living in shelters and the people, the staff caring for them. So we're really taking care of our dental patients are being called. So we see them as our patients too. So we're really looking at, you know, trying to go from the most at-risk people, the people that if they get COVID, it could be a death sentence for them. We want to make sure, and that's why making sure that we're getting the people who are most at risk, those are the older people and those people with those chronic illnesses, get them vaccines quick, because we're in a race against time here is another thing to remember. We've got these variants that are more contagious. We might have variants that aren't so good at the vaccine. And if we get everybody vaccinated and quash the spread of this disease, it won't have a chance to mutate and create those new variants. And that's the way we're going to get out of this pandemic. So I would say for the people that are frustrated, remember, we have all been working very long hours for almost a year now. and we are exhausted, and we are doing the best that we can. And we really, really have the same goals as that you have. We want to get back into doing our normal life and having our normal work hours and going, to happy hour on Friday night with our friends. We want to get back to that too. And so we're all on the same team, and we're all working together, and just recognize that, I guess.
That's great. I actually have not heard Dr. Fauci refer to happy hour, but he should. Steal some of the, he should steal some of your material, Dr. Johnson. Well, thank you for being with us. I hope we can get you back next week, and we'll do an update. And
Yep.
I think we not only need vaccinations, we need information. I think folks feel
Sure.
better, more secure, more patient when they know that folks like you are taking the time and making the effort to get everything lined out, and it's going to get better. When they hear that from you, they have a lot of confidence that the solution is on its way. We just need more vaccine, more vaccinations. We got to hit the South Side with those needles, get that in people's arms, go where the need is the greatest, and protect the people who are most at risk. So thanks,
Yeah.
Dr. Johnson. We'll see you
Thank you.
next week.
We'll see you next week.
Appreciate you.
Bye-bye.
Thank you. Well, I think that is really, really helpful, folks, to have that kind of assurance from the chief medical officer at La Familia. Let me quickly bring some other things up. Number one, we talk a lot about testing and the Novid app. If you want a free at-home COVID test, because one of the ways we get from being a red county to a yellow county to a green county is we have more tests that turn out negative. And we need more tests to go negative in order to get open as a county. So a free at-home test is available to you. learn.vaulthealth.com/nm. learn.vaulthealth.com/nm. Absolutely free at home. Also download the Novid app, Novid. It will give you a reading about whether you are in the neighborhood of someone who may have tested positive. Think of it as a radar screen, only instead of telling you that a snowstorm is on the way, it'll tell you if you have been in the neighborhood or near someone with a COVID positive test. More things to think about related to COVID. PNM, a note from Jamie Aranda, who is always trying to reach out and help folks with the public affairs communication. PNM wants you to know that if you have a past due energy bill, the deadline for help has been extended to March 31st. So call PNM 855-364-2950 or go to pnm.com/help. Find out more how you can get assistance with your utility bill. Group of folks doing something very, very, very nice for those who are doing so many things for us. There is a fundraiser January 30th, Saturday at 5 p.m. It starts and it runs Sunday, January 31st at 5 p.m. called Tonic for the Times. Gratitude for our New Mexico COVID caregivers, the folks that Dr. Johnson was just talking about, a fundraiser for the at-risk community who are really, we need to step up and give them some support. You can go to tonicforthetimes.com. It's a fundraiser, it's entertainment, there's music. The governor will say a few words. It's going to be a lot of fun. It's going to be for the benefit of our caregivers and some of our most at-risk people. And speaking of folks who are at risk, but not so much because of COVID making them sick, but because of COVID risking their businesses. And that's all of our mom and pop shops here in Santa Fe, our bakers, our retailers, our folks who do landscaping. These are people who are our local Santa Fe mom and pop businesses. Please shop local. When you shop local, You keep your money here in Santa Fe. We give people paychecks. We put them back to work if they've been laid off or if the business has had to slim down. We want folks to get back to work. We want our economy to rebound. So shop local, right? One way to do it is on the web, SantaFeMarketplace.com. Our tourism department, our economic development team is helping our mom and pop shops, our local businesses stand up websites and then pull them all together in one place. SantaFeMarketplace.com is that one place. You can go there and help support our local businesses. Quick legislative update. We put in a good word. I sent a letter in yesterday to support the community solar bill. You may have seen the President Biden making a statement that climate change is a national security issue. We need to go green. We need to pivot toward the energy policy of the future. The energy policy of the future is right now. And so there is a bill in front of the legislature to encourage community solar so we can have more community generated solar energy at the level of your neighborhood so that if it doesn't work on your house, there could be a little group that goes in together for a community solar uh, set of panels. That made it out of the committee yesterday. We're grateful to those who voted in favor of that bill. There's another bill called the Local Choice Bill having to do with the ability of folks to pick how they're going to tap into energy. We're trying to build the 21st century energy policy for New Mexico. We will, over time, migrate toward greener jobs, greener energy creation, more conservation, so we don't waste energy. The city is about to vote on a set of measures to have our streetlights go into LED technology. They'll be less expensive, more energy frugal, less light cast up into the sky, disrupting our beautiful night skies here in Santa Fe. It's a win-win-win idea. It's part of our sustainability agenda to make Santa Fe the single most sustainable community in the United States. Last night, we had a special meeting of the governing body to vote on our amicable decision with the master developer to terminate our agreement, our exclusive agreement with them. Council voted unanimously to do that. None of this changes how special that site is. It is the geographic center of our city. It is the geographic future of our city. We have to make it shovel ready, and we have to begin the process now of planning a suite of projects, a new way to go forward, to take advantage of all of the resources that are on that campus. The Garson Studios are a gem. There's room for housing, for affordable housing on that site. There's room for sustainable development on that site. A lot of possibilities to make that our new town center. It is still a remarkable opportunity that we've been handed. Nothing comes easy. These are hard developments to work through. COVID has changed the economy in significant ways, changed the risk reward ratio, but we're going to work with our city team to look at options and bring those forward by the end of February to the governing body to decide how best to move forward. There is also a special meeting of the governing body Monday at noon. That's to vote on an extension of the emergency order that I put out, and it simply reaffirms that we are in an emergency. We have to be mindful of the ongoing crisis of COVID, as well as the need for all of us to stay healthy, wash our hands, wear face masks. The police will be enforcing that face mask ordinance now more aggressively, and we want to crack down, move Santa Fe from red to yellow to green, and reopen. So that's pretty much it for today. Have a nice weekend. Remember, as we go into the weekend, to stay safe. Bend the curve of COVID. Wear your mask, wash your hands, practice physical distancing, stay within your family bubble, and have a really lovely weekend. Shop local, buy local, get some takeout, have a little family dinner from a takeout restaurant of your choice. So till I see you next week, please stay safe, stay healthy, take care of yourself, take care of your family, take care of our community. Together, we will all take care of Santa Fe. I'll see you next week. Thanks, everybody.